Hey everyone, this is Shoaib. My teammates are Meghana Srujana and Meghana H. Our project is on healthcare records management system for patients using Microsoft Azure under the guidance of Mr. Madhukar CS, Associate Professor, Department of ET. These are the outlines of this PPT. The main aim of this aim of the project, sir. The main aim of this project is can patient can access the data at anywhere at any time they want. Here, the patient presenting a web development for healthcare records management system. We are presenting a web application for patient records management system for patients using Microsoft Azure. In older days, maintaining healthcare records management in books is complicated, a little bit complicated. Whereas this project will help the patients and hospitals to maintain the records for many years. Introduction. Healthcare records of an individual is recorded which maintains from the birth to death of the individual. These records includes all health diagnosis reports, doctor's view on the health of an individual, vaccination, and also regular checkup done at home itself. Health records when maintained electronically helps the physician faster diagnosis and cut down the cost of unnecessary repetitive diagnosis. There is a need to have predefined standard for information capture. From the moment a patient record is created, it must appropriately stored, secured, and maintained. Block diagram. Our block diagram includes patient management system in which patient management in which patient can manage all the records of their health and medicine management. In medicine management, the patient can have access what are the medicines they need to take and all. Test management, if any test is appointed to them, they can manage the tests. And doctor schedule, if the doctor one needs to schedule to the patient, doctor can schedule through the patient doctor management. Disease management, your patient can check their diseases which they have. Doctor management, doctor can manage all these stuffs and all these things all these things they are which are included in this software. Further will continue by my teammate.
Good afternoon, everyone. Myself Meghana, and I'm here now explaining about the objectives. Firstly, improve security and confidentiality of patient and data and records. It will maintain some security and confidentiality of a patient without accessing unauthorized person, and it will maintain its patient's ID, name, and login screen of all the details all been stored here, and improve communication between health and professional. Here we should have a good communication between patient and the organization. Communication plays a very important role and simplifies the workflow for the clinicians. By making this project, it will help the patients to uh, it helps the patient to get an easily available in their home and reduce administrative cost. Administrative cost means where the patient have go again and again to a hospital is being reduced, where they can access their previous records in their system, provide a better patient experience. By this, the patient can easily access without having any distractions in the or have to go for a hospital. There is no, so it is give a very good better experience. This is about the flowchart. Firstly, we will log in into our screen of Microsoft Azure. There we will give an there we are having on the password and ID. If it is correct, then it will move towards the user type. If it is not, it will again go back to the login screen. If it is your valid ID, then it will move towards the patient user and the admin of hospital. It contains all the details of one patient, admin of an hospital, which gives the access of details. And if a patient login into a user, it will go to the user admin. Here, if it is correct, then it will go to the redirect to admin. In this redirect to admin, we have some features we are implemented, like admin details, patient registrations, and medicines management, dosages. All these maintenance features has been here. By this, we can access these patient records. Finally, we can get logged. Next slide will be explained by Meghana.
Good afternoon, everyone. I am Meghana M,
and I'm here to explain you about the software requirements. The software requirements are Microsoft Azure. Microsoft Azure, formerly known as Windows Azure, it is a cloud computing platform and it is used to develop the applications and it is also used to store the data. The next one is the JavaScript. JavaScript is a scripting language that enables you to create dynamically updated content, control multimedia, animated images. JavaScript is a scripting language for websites and it is used to create and animate images. Next one is the TypeScript. TypeScript is the syntactic superset of JavaScript which adds static typing. This basically means that TypeScript adds syntax on top of JavaScript, allowing developers to add types. The next one is the Vue. Vue is a JavaScript framework for building user interfaces. It builds on top of a standard HTML, CSS, and JavaScript and provides a declarative and component based programming model, and it is a JavaScript framework for building user interfaces. It builds on top of standard HTML, CSS, and JavaScript and provides a declarative and component based programming model. The next one is the Docker. Docker is a software platform that allows you to build, test, and deploy applications, and it is now used to develop a modern applications. The container used for Docker is called the Docker Nginx. The next one is Node.js. Node.js is an open source cross-platform runtime environment for executing JavaScript code. Node is used extensively for server-side programming. It is used on Windows like Mac OS and etc. Next one is Postgresql. Postgresql is a powerful open source object relational database system with over 35 years of active development that has earned a strong reputation for reliability, future robustness, and performance. The Nginx is a open source software for web serving, reverse proxying, caching, load balancing media streaming, and more. It is used for developing the busiest websites like Twitter and Facebook, etc. The further slides will explain by Srujana. Yeah, good afternoon, everyone. My name is Srujana. I'm here to explain results obtained. This is a login page. Here we'll give a admin and password, username and password. Then we'll go through our website. And these are the features of our website. Here, this includes find patient record, visits, register patients, admin, programs, employees, store, health insurance, and pharmacy and laboratory. This is the find patient record. Here a patient can find their records, and this is a visitors. If a patient want to visit a doctor, can go through this. And then this is cash patient, emergency patient, and ordinary patient. If a patient has no insurance, can create over here. If a patient is an emergency, he can create insurance over here. And if he is an ordinary patient who has no even hospital ID, can create over here. Then here admin includes departments, units, wards, and beds and services. Then create employee, find employee. If a person is already an employee, can view his files. If a person is not an employee, can create over here. Then pharmacy store and laboratory store. He can view all kind of medicines and all in a pharmacy store, and all kind of tests, lab tests and all can be viewed in laboratory store. Then insurance type, HMOs and policies. Insurance type, what all insurance types can be provided will be viewed here, and health management organization provides insurance, and some policies are applied here. Then generic drugs, dosage form, and dosage measures. Here generic drugs are a medicine provided by a doctor, and the dosage form which is prescribed by doctor can be viewed here, and the measurement of a dosage can be taken for a patient can be viewed over here. And then sample test and NHIS test. Here all kind of laboratory test can be viewed. Then future scope, predictive analysis, personal health records, and telemedicine. Here
um, predictive analysis in the sense it predicts the future patients outcomes and identifies what treatment to give patient based on their health conditions. And telemedicine in the sense helps preventing diseases and promotes health in many areas. Then advantages, it gives a better patient care and enhances security, and it's also a cost saving, and it is effective retrieval. Then its security risk means as we are using Microsoft Azure, it can leak our data, lack of control over data, and dependency on technology. This website is depending on Microsoft Azure, and cost of Microsoft Azure is higher. So the people who are not rich cannot be accessed. And then applications, it's an electronic medical records and predictive analysis and clinic trials. Predictive analysis, here patient outcomes and identifies what treatment to give patient based on their health conditions. And conclusion, using Azure for healthcare records can provide numerous benefits such as secure storage, efficient data processing, and seamless collaboration among healthcare providers. Yeah, Azure offers advanced security features such as encryption, access control, and audit trails to ensure that healthcare record remains confidentiality. Here, Azure machine learning and analytics capability enables healthcare organization to extract insights from the data to improve patients' outcome and optimize operational efficiency. And health Azure for healthcare record management can improve patient care, enhances productivity, and reduce cost for healthcare organization. These are the papers which we have referred. Thank you. This is a website of our project. This is a login page where we'll give username and password. These are the features of our website. Uh, Register patient. Here a patient can create his profile, which consists of cash patient, LIC patient, emergency patient, ordinary patient. If a patient is having an emergency, can create over here. And if he is an ordinary patient who is not having hospital ID, can create over here. And if a patient is having no health insurance, can create over here. And then here we can find patient's record. Then visits, here a patient can visit a doctor. Then admin consisting of departments, units, wards, beds, and services that will be provided by hospital. And then program, here it consists of antenatal program. By enrolling into this program, means patient who is pregnant and having 2 or 3 months of baby can learn how to take care of their babies. And then employees, if a person is an employee, can view his record. And if an person want to create an employee, can create over here. Then store, it consists of pharmacy store and laboratory store. Pharmacy store consists of medicine, and laboratory store tests to be done to the patient. Then health insurance, what kind of insurance will be provided by hospital can be viewed here. And health management organization provides some insurance can be viewed here, and some policies will be applied for this insurance can be viewed here. And this is a pharmacy store. Here generic drugs, dosage form, and dosage measure can be viewed. And this is a laboratory store which consists of sample test, NHIS test, Sample test includes all means samples to be taken from the patient, and test results will be provided, can be viewed here. And NHIS test, in the sense, if a patient is having emergency and want to contact a doctor from his own place, can be viewed here. Thank you.